This is the blood pressure video. So prior to coming to the resident's room, I washed my hands and I assembled any equipment that I needed in order to complete my task at hand. So I'm knocking on the door and pausing, I'm coming in. I'm introducing myself to the resident, my name and title and what I'm about to do and perform, and I'm addressing by full name and proper title, confirming that that's what the resident would like to be called by. I am then checking forms of identification, asking for birth date, checking for ID band, etc. I need to make sure that I'm treating the proper resident that I need to be treating. If any visitors were in the room, I would politely ask them to leave unless it is the resident's wish that they stay in the room, then that is okay. I'm closing the door for privacy and I'm pulling the draw curtains completely. I am going to, all my supplies are on a clean bedside table. If it's not clean, I have a barrier to protect. This is clean, and I have my notepad with a pen and my blood pressure supplies in order to take blood pressure. So what I'm going to do is put this on. Prior to taking this, I need to make sure that the resident is sitting for at least 10 to 20 minutes. They could be lying down or sitting. Sitting, they need to have their feet flat on the floor and then wrist side, palm side up. The cuff is going to place on the brachial artery about 1 inch above the elbow. I need to make sure that I can visually see. I'm cleaning with alcohol wipes and discarding in the wastebasket. I do not want to hold the stethoscope with my thumb because that has a pulse, it might interfere with my reading. Place it on the brachial artery. I'm inflating to about 160 to 180. If I still hear a heartbeat, I need to stop, deflate, wait 1 minute, and then inflate it to 200. It was 116 over 70, which is normal. I'm going to sanitize, discard, and I'm going to record the blood pressure. I have the patient's name, and I'm recording 116 over 70 mmHg, which is millimeters of mercury. So the first number that I heard on the stethoscope is the systolic, and normal systolic is 90 to 120. The diastolic is 60 to 80. So if any of the blood pressure readings are irregular or abnormal out of those ranges, that is something I need to report right away. I also want to add that when taking blood pressure, there are guidelines in order to complete it safely. I needed to make sure that this was the proper arm to take the blood pressure on. If there's someone who has an arm cast, an IV, a dialysis port, that is contraindicated, I cannot do blood pressure on that arm. If it was a woman, any breast cancer surgery on whatever side, I cannot do the blood pressure on that side of the arm. Let's see, what else?
I think we're done, and it's my time for my social
If I
activity.
wanted to, I needed to turn down the TV if it was too loud. I needed to turn down and let the room be quiet. Yeah, and that's it. Okay, so then I would do my closing tasks. I would wash my hands. I would clean all the supplies that I used. I would make sure the resident is safe, back in bed with a call light or staying in the chair with a call light attached. I would politely ask the visitors to come in. I would make sure the bed is locked if back in bed and positioned properly to its lowest position.
All I can say is thank you for taking good care of me, Nurse Wiggington.
And that is it.